coronavirus diseases, COVID-19 pandemic on autism spectrum disorder, a research project done in collaboration with WISH and Qatar Autism Society. Dr. Sana Al-Harahshe from WISH participated as co-lead PI in this project, and Mr. Mustafa from the NEGDAR Center or the Qatar Autism Society. The outline of the talk going to be first, I'm going to talk about the background and significance, then objectives, methods, collaborating institutions, and the initial findings, and the last one is conclusion. The background and significance. As we know, the measures taken by most countries to control and limit the spread of this highly infectious SARS-CoV-2 virus, including the closure of schools and centers, providing treatment, rehabilitation, and educational services for the individuals with ASD, has negative impact on those individuals and their families. And so efforts are being made by most service providers in finding alternative ways to compensate, even partially, for these restrictions in order to alleviate the intense burden on ASD individuals and their families. The objectives of this study, the first one, to evaluate the effect of measures taken to control COVID-19 pandemic on services provided for the individuals with ASD and their families. The second one is measures taken by service providers to find an alternative ways to make their services available for those individuals and their families. And the last one, to see, to evaluate the impacts on ongoing research and studies done on ASD, whether in Qatar or all over the world. The methodology, it's a kind of a cross-sectional online survey design was used in this study, a set of questionnaires formulated both in Arabic and English language by the research team, which had been sent to families through the Google's forms and through an emails and WhatsApp notes to the families asking them to participate in this study. The second one is for a set of questionnaires for service providers and scientists working on ASD research in different institutions and centers in Qatar, which will be collected later on, analyzed and evaluated by the research team. This is a sample of the questionnaires posted on Google's forms. You could see that the introduction, and this message to encourage the families to participate in such an important study. And these are also samples of how the questions appear on the forms. The families, once they see them, if they agree to participate, they will go through these questions and they answer them. And these are, the respondents, the form or the analysis, which is usually the preliminary analysis made by the Google's forms. That's how it looks like. Now, the sampling technique, it's a convenient and snowball samples used. The target sample size for the whole project is between 200 and 400 families of individuals with autism. spectrum disorder. Currently, we collected around 156 surveys, and we are working to complete the study. The data analysis, we first coded the data, then analyzed using the SPSS, which is a kind of a descriptive statistics. The collaborating institutions, as I mentioned in the beginning, Qatar Biomedical Research Institute, Hamad bin Khalifa University, and the World Innovation Summit for Health, WISH, and Qatar Autism Society through Nigdar Center. The findings, the demographic findings, you see those respondents, the distribution of those respondents by age and gender. We could see here around 72% of the respondents were male, compared to 28% for females. And this doesn't mean that the age ratio, male to female ratio, it's the same, because I'm going to show you later what we found during our prevalence study, the exact age gender ratio. Also, we can see here the age group. Most of the respondents lies between 3 to 13 years, which makes it up to 93%. And this will give you an idea that those age group that are the most problematic in home quarantine and keeping the children with the ASD at home without any intervention, therapies, etc. Now, this is what we done 2 years ago during our prevalence study. It was a national prevalence study, included age between 5 to 12. So among that study, we did a screening for the primary schools in Qatar and all the centers and hospital providing services for the individual with ASD. And what we found that the girls-boys ratio, I mean the gender 1 to 4, which is almost similar to the international one, and the prevalence rate among age group 8, this is the age used by the CDC, the United States of America. We found that the prevalence rate 1 in 66 compared to them that time 1 in 59. Of course, the present rate is 1 in 54. The overall prevalence, it's 1.15%, which makes it 1 in 87 children born here. They will have ASD during their life. The ratio also, you can see it, 1 in 56 boys compared to 1 in 230. This is what we've done during our prevalence study. Now we'll come to our study. First, we asked about services provided before the COVID-19, and we can see 76% of individuals, they usually attend centers, schools prior to the start of home quarantine. And these are, they provide interventional services, therapies, different kind. 14% of them, they have a part-time attendance, while only 10% they didn't participate in any intervention services. The other point is individuals receiving in-home therapy. I mean, this is in addition to the attending the centers and the for intervention. Some of families, 17% of them, they receive in-home therapy, which is an extra and additional therapy for their children. And the other one is individuals receiving additional therapeutic services outside the center. I mean, for instance, children with ASD attending a center like Rinad or Shafallah Center. Some of them, 26% of them, they usually seek for additional therapeutic services outside the center. So you could see before the start of the quarantine and the COVID-19, pandemic measures, most of our kids here in Qatar, affected individuals affected with ASD, they have a very well programmed for intervention, and most of the families, they are participating, except very, very few numbers. Now, we'll come to talk about the impact of the COVID-19 on ASD. First, the children abided by the home quarantine. We can see 69% of those kids, they do abide and they accept the idea of being home, especially during the beginning of the quarantine, while 31% of them, it was very, very difficult for the families to keep them home. So they need to be taken outside, whether to the malls and to, due to their condition. And the other things is that we could see that only 11% of those individuals with ASD, they were receiving any kind of intervention sessions from a qualified specialist during that period of home quarantine, compared to 80% who have nothing whatsoever, while 9% of them, they will have some intervention to some extent. So this means that most of the individuals with ASD, they are staying home without any therapeutic interventional rehabilitation or whatsoever. And that's the most important burden and impact on those individuals, and definitely on their families. The next slide show you the problems and issues with the child being at home. You see, most of them, 65% of those individuals, they have different kind of problems staying at home during that quarantine. Only 35%, it seems that the families were successful in keeping them calm, but still 65% of those individuals, just imagine them sitting there home with so many different kind of behaviors, aggression, self-injuries, hyperactivity, etc., etc. So the impact is so severe on the individuals with ASD and on their families. Child exhibit negative behavior since the start of the in-home quarantine. You see, this is very important because 53% of those individuals, they exhibit different kind of negative behaviors since the start of the home quarantine. And the reasons is obvious, because they are not having any therapy like occupational therapy, speech therapy, and you name it. So it was very, very difficult. Now I'm going to leave the floor to my colleagues, Dr. Sana El-Harash, to continue to present the other findings. And thank you very much for your attention.
So, as Dr. Fuad indicated, the COVID-19 has severe impact on families and their autistic children. So, child participating in any physical activity inside the home It's not just, the impact about the behavioral issue. It's affecting their physical activities. Due to quarantine and the measurement staying home, they have less physical activity. As we can see from the numbers, 5% they don't have outdoor space, and the majority, they said, with the 29%, they don't participate in any physical activity inside home or outdoor, whereas 36%, they said sometimes they participate. So the impact of COVID-19 is highly prevalent, and we can see all the effect through the numbers. In addition, not just physical activity, it's affecting their sleeping schedule to some extent with 13%, and 58%, they said yes. The majority, they said yes, compared to just 29%. So, and when we asked them if their autistic children presently participating in online learning, the majority, they said, actually 50%, almost 45%, they said yes, 45% they said no, whereas 10% to some extent. So it depends if they get extra help or access to the right learning stuff that match each child condition. The impact is not just on the autistic children. It has an impact on the family who are caring for their autistic children. So one of the impact that reducing social contact as a result of COVID-19, the majority with 92%, they said COVID-19 affected greatly their social contact by reducing it to the minimum, and compared to just 6% who said no, whereas 6% they said no, and 2% they said some extent. And there is the results shows a significant change in family daily routine. 96% they said yes, whereas 40% they said no. Not just, affecting family with autism, with autistic children, it's affecting a lot of families around the world and interrupted their daily routine. But families with autistic children, they have a specific program or systematic program for their autistic children. And this is interrupted by the COVID-19 and mostly staying at home. Also, it's affected their access to online autism support, as 28% they said yes, but the majority they said no. Even with the percentage of 28, it's 1/4 almost, they said it get affected, and they don't have access to online autism support. Now, the level of stress, COVID-19 and all the measure increase the burden on the family and elevate their stress very highly. When we ask them about the level of the stress during COVID-19 pandemic, the majority, about 50%, they say they are very stressed and distressed, whereas 17% they say neutral, and 28% they are either normal or not stressed at all. We also asked an open-ended questions about the impact of COVID-19 on autistic children and their family. And here we are presenting some of the results and quotation from the family, which is, qualitative interview. The first one, they talked about the level of stress and the reduce of the social contact. The pandemic has added more stress to an already stressful situation. Autistic children have daily routine. When that routine is disrupted, it has a mental and physical effect on the families and on the child with autism. Life is already difficult, and then with the lockdown, it's impossible to have any normality. Families need more support available to them in time of crisis. I also find that this survey should have been available to us before now. We have been locked down since March. No one has bothered to ask the already struggling families how to cope with the lockdown. Shows you the stress they have it added to the already stress they have with their autistic children. Another quotation from the family shows that there is lack of social connection and outgoing, because previously we have shown that COVID-19 has interrupted their daily life routine and reduced the social contact. For example, one of the participants said, lack of social connection and outing, the staying at home was caused a negative shift for us as a family and for our child. His skills and behavior have changed, and this is our main challenge. We are worried about how he will resume when hopefully life goes back normal. Another quotation talk about social isolation. Social isolation and feelings of loneliness were very difficult for me, and I know my son's social skills were affected as a result of staying away from society for these past months. It's not just social contact difficulties. They have financial difficulty as well, like job loss stress, health stress, about visiting a health clinic and social distancing struggle. Those are just quotations we selected from the respondent. So in conclusion, the first part that was discussed by Dr. Fouad showed that clearly COVID-19 affected negatively clearly the negative effect of COVID-19 pandemic closure on health and the well-being of all individuals with ASD and their autistic children. We have shown that they experienced regression, behavioral problem, and symptoms and general deterioration. The lockdown and the suspension of providing intervention, rehabilitation, and education service for individuals with ASD, with exceptions for some relatively minimum online resources, it's add more a great burden and tremendous amount of psychological stress on both autistic children and their families. So the impact on families was very obvious from our initial results. Family of individuals with ASD face multiple changes that may keep them away from socializing, interaction with other families. Even it's interrupted their daily routine and staying at home for a long time. As some of the family, they said their behavior, they are experiencing difficulty with their behaviors, even regression in their in their health and their situation. So this challenge is particularly difficult for family of a new diagnosed individual and those were awaiting to do more diagnosed appointment prior to the pandemic. Thank you for listening to us.
Okay, now I think we have some questions.
Okay.
Rabih, can I answer? Okay. So question one from Iman Ghazal. It says, what measures do you suggest can be done to compensate the families and children for the intervention lost due to the COVID-19 related measures, which means that quarantine, closure of schools and centers, etc. Actually, we hope that by the end of the COVID-19 measures and by the introduction of, the vaccines, etc. Even before that, now most of the healthcare providers, they are trying their best to develop measures to, as we mentioned before, to alleviate that effect, to introduce certain remote learning kind of intervention, and to me, this will help. I mean, although it's not like when the children attending the centers, definitely. But I heard that some of these centers started to welcome the students, I mean the children, individual with ASD. For instance, the Shafallah centers, they started to welcome 30% at a time, and other centers definitely are following. This means that there should be, I mean, the healthcare providers, they should intensify and increase the intervention sessions so that to cope with what happened negatively on the children affected with ASD. As we showed it in the presentation, so many individuals affected with ASD, some of them more than 30% had regression in whatever they learned before, and more than 50% of them, they're having problems. So good plan should be done to compensate for that and to overcome this problem. Also, to me, it's not easy, definitely. Not only here, everywhere. The problem is an international one. All the individuals with ASD and with even other certain disabilities are suffering because they are kept away from getting the usual therapies and interventions through the schools and the centers, etc. So it's a great burden on the healthcare providers, and I hope that they will be successful. There is also another question. Let me have a look at it. Okay. Question 2. Would you like Dr. Sana to answer this question? From Adeline Morse. Says many people state that the cure for COVID-19 should not be worse than the disease. Is this case here? Is this the case here? Would you like to answer this question, or?
I can pass it to you.
Okay.
Okay.
Actually, you see, I mean, the cure for COVID-19 should not be worse than the disease. I hope that I understand what he is, meant by this question. Of course, the issue is whether those individuals are exposed to COVID-19 and got the COVID-19, or, I mean, the cure, in general, I mean, as a community, when the whole epidemic passes and everything returned to normal, definitely, you see, COVID-19 going to affect life in every single part of it, socially, scientifically, mentally, psychologically, and until now, studies are being done to cope with all these different kind of effects of the COVID-19 pandemic. And I hope in the near future we can have a better idea about what have been done by this pandemic in all parameters. I mean, as I mentioned, every single family, whether they have children or individuals with special needs, or even the typically developed individuals, they suffer because of the remote learning, limitation of social interaction. So it affected everybody. And I mean, as I mentioned, studies are being done to see what's happening. For us, we are trying to see the effect of this COVID-19 pandemic on the three most important things on autism: on the individuals with the autism, on their families, and on the researchers and scientists who are doing studies on this, disorder or any disorder because of the limitation. Of course, for us, we stopped recruitments for since March till now, and we have a number of studies going on, and we took that time to go and look at the data, analyze the data, trying to submit some manuscript, but still it affected everybody. It affected all the research program. So that's for us. We are looking for the effect of the COVID-19 on individual with ASD, because I think it's very, very important. It's very, the effect is tremendous for the families. I've been contacted with so many families that I know, and my God, they were stressed. The effect tremendous. And we hope that we can do something to alleviate those effects. Now
I can take this, Dr. Fuad. Has the effect of the COVID-19 pandemic restriction on the mental health of caregiver of children with autism been studied in Qatar? Through our literature review, when we started this project, the topic is new, the COVID-19. But to our knowledge in Qatar, our study is the first that looks at the impact of COVID-19 on autistic children in terms of physical health, access to the services, even the mental health of the family. We just show that when we ask them, the family, about the level of the stress, the majority, they exhibit high percentage between very stressed and stressed. And of course, this is an important study to look at it. And families with autistic children already have stress, but COVID-19 add a great burden to the stress they have. So our study is the first in Qatar on autism, but I'm sure from our literature review that there are some studies internationally.
Okay, so I will move to the other question, question number 5 from Fatima Al-Muhannadi. She's asking, is there advice for our kids who are staying at home with no therapeutic services? Okay, the advice, as we mentioned through our presentation, it's not easy at all for the individual and the family to stay at home without any therapeutic intervention. And it's different part, whether it's occupational therapy, it's a speech therapy, and you name it, there are so many. The advice is just to try to communicate with your service provider to help, because I know some centers, they have been recording the sessions, the therapeutic sessions before the COVID-19, and this, I mean, to make to present it to the kids or to the family remotely. It's similar to remote or learning kind of schooling, you know. It might help, So if it's better if you can communicate with your provider center to ask them whether they have anything, any sessions they can send you. And the other things, you see, we always advise families to be to take some responsibility in therapy of their kids. They should be part of any therapeutic program and measures, whether it is occupational therapy or speech therapy. This will augment and help help their kids to learn better, to move better with their ability. That's what we can advise, and I hope, and I'm sure now some of the centers, they started to bring the individuals for their intervention therapy, which is better than keeping them at home. At least there is some hope.
Okay, I can take this question from Galia. In what ways has COVID-19 compromised the health of ASD children who also happen to fall ill because of the pandemic? From our studies, we showed that COVID-19 has affected autistic children and their family greatly. And we showed that they have some behavioral problems, and they with regression in their progress, and they have some effect on their physical activities as the measure, and they don't go outside. So the majority, they said that they don't exercise or have physical activities. There is a big change in their daily routine, because autistic children, they have a program, a systematic program. If you interrupt their program, this will affect them greatly. So their daily routine has been interrupted, even the social distance and reducing the interaction. Of course, will all affect their health. And one of the questions we asked if they have a problem accessing health services or emergency services, and the majority with current pandemic, they indicated yes. Would that mean, because when we go to any healthcare center, there is a priority or emergency. For emergency, they can get, but for daily health treatment, they don't get it like as compared before the COVID-19.
Okay, I will move to the other question from Abdullah Al-Muhannadi. He's asking, is there any successful country example worldwide to tackle ASD during COVID-19 using telehealth or digital technology? Actually, you see, we've been in contact with so many. I myself and the team being in contact with, we have collaboration all over the world, especially from the US. And we found that they have the same problem that we are having here. I mean, they are trying their best to use the telehealth or digital, sending therapeutic sessions through Zoom or through TM, etc. They are also trying to develop new techniques. And we hope at the end of this pandemic will make everyone how to find a way to deliver their therapeutic sessions through, the new technology. And I'm sure that since, for instance, from the educational part of view, most of the schools, they are developing, and even colleges, developing good programs to convey their courses through a tele or through the Zoom or the other ways. And now we are seeing that even in healthcare provider, most of the some of the physicians, they can communicate with their patients by the phone or through the TM, telecommunication, and they listen to their complaint, and even they offer some of the treatment through that way. So I think all of the problem is the same all over the world. The same here. What we found from the families here in Qatar, it's the same problem all over the world, and all the service care providers trying their best to find a way to overcome this problem. And as I mentioned, it needs experience, and this is a good time so that if we are going to be exposed to another pandemic, whether COVID or some other, we have some answer or some solution to make it easy for the easier impact on the families and individuals with disabilities in general, and especially those with ASD. Is there any other question? I don't see other. Okay. At the end, of course, I would like to thank you, the audience, for the attention, and those who had questions to ask. And I also would like to thank all my collaborators, Dr. Sana Al-Harashe, Mr. Mustafa, Iman, and all the team working on this project. And we hope that we can get the data from the other two parts of the projects. The effect of the COVID-19 on the providers, not only on the families and the individuals, but also the COVID-19 affected the providers. So many of them, they suffered, because they are private, and it affected their income for the centers in general. And also it prevented those professionals to update their knowledge, to go, for training, etc., and also for the researchers. And we will hoping that we are going to see all these problems in order to find a way how to overcome these in the future. And this will affect the whole society. Not only the families and their individuals with ASD, but also the health service providers and researchers, etc. So I would like to thank you for your attention, and we hope to meet you in the future. Thank you.
Thank you all.